And welcome back. It's time for Morning Rounds. January is Cervical Cancer Awareness Month, a time to talk about how HPV vaccines can help prevent cancer.
Thanks to cervical cancer screening and HPV vaccination, cervical cancer is actually the most preventable of all female cancers. Dr. Tamara Helfer with Christie Clinic is sharing how early protection can be the world of difference. Good morning, doctor. How are you doing this morning?
Good. How are you all?
Good. Thanks for joining us. So first and foremost, let's talk a little bit about cervical cancer and how many people it actually affects.
So when we look at it, we also look at HPV, and HPV, about 79 million people are affected with HPV at about the college age. That's between late teens and early 20s. And so that's really the risk right there for infection going on to become a risk for cervical cancer. And then about 14 million people are usually infected yearly in this age group also. But vaccination can truly help decrease these numbers drastically.
And what are some of the most common questions that parents have about their young daughters when it comes to HPV?
Main questions are, why should we go ahead and get the vaccine? How does this help decrease the risk of cervical cancer? And there's a couple of things. One, the vaccines don't only help against high-risk HPV, but also low-risk HPV. High-risk HPV has a higher risk of going on to cause cervical cancer, and then low-risk HPV is that causing genital warts in that area for females. So when I talk to women or young girls about this, the one thing I do recommend is going ahead and getting it early, usually after menses starts around age 11 or 12. You can get it as early as 9. We usually recommend waiting until after menstruation, then go ahead and get the vaccine at that time. We also do recommend it for males too, because males are the vector that transmit it to the females. So it's very important for both females and males to get the vaccine. And if we were to get everyone vaccinated, it would drastically decrease cervical cancer. Remember, cervical cancer is the most preventable of all female cancers because of the fact we have a vaccination against it, which is amazing. And so we should use it more often.
And you know what, doctor, you just mentioned, of course, we think about women when it comes to cervical cancer, but you mentioned those boys who should be getting that HPV vaccine as well. Can you talk about why it's so important for the boys as well as the girls to be getting that vaccine?
Yes, and I'll just start out with the fact that my husband and I have 4 boys, and we are the first in line to make sure they get vaccinated, because just like anything else, we want to decrease their risk of giving a disease process to another person. And so if we can do that by vaccination, that's huge. And so the vector, men or boys can carry the HPV and not realize it and transmit it on to the females. And so if we can prevent that, it's huge. And so vaccinating both girls and boys is very important. Doing it early is very important too, because their immune system takes up the antibodies better and does a better response. And so if we can do that at the younger age, then they'll have a great autoimmune system throughout their time that they could be exposed to the HPV.
And doctor, is there a specific reason there is that 26-year-old cutoff?
Well, the study was done like anything. We do studies up to a certain age, and so age 26 was when they did the cutoff. Now, this is a question because a lot of people ask me, I'm age 26, can I get it? And yes, you can start it when you're 26 and complete it afterwards and still have that coverage. But the thought process was, until up to that point, it's your body's antibodies are best response at that age group. So the earlier we get it, the better antibody response. The further along, you have less of a good antibody response, but you still have the benefit. And so that's the one thing is that you saw there also, you could give it through ages 27 to 45. They did another study to see if that group was would have a good antibody response to it also. The issue with that is the fact that you're older, the antibody response is not probably as great. And secondly, you've probably already been exposed to HPV viruses.
And doctor, of course, we want to talk about the vaccine this morning, but can we also touch a little bit on HPV itself? And are there any warning signs that a woman should be looking out for?
So HPV, it's really hard. The high-risk HPVs don't give a ton of warning signs. Sometimes you can have bleeding with intercourse. Sometimes you can have just a discharge. The one that they see more often is a low-risk HPV, can cause genital warts, and so you can see that down in the vaginal area, and so that's a risk for the low risk. The high-risk ones are the ones we're more worried about that can go on and cause issues with cervical cancer. So the best thing is to obviously come in, talk to your doctor, and see if you're at the age that you need to do a co-testing, which is a PAP and an HPV, or just HPV testing, or just PAP testing. And your physician will look at your information and decide what's the best choice for you.
And doctor, you mentioned some of the side effects there. Can you think of any other reason to not get vaccinated against HPV?
If you have, some people do have risks of having an immune response or a anaphylactic reaction to it. It's very uncommon, but some people don't get vaccinations due to the fact that they respond badly to them. But mainly the vaccine causes soreness at the site of injection. It causes a low-grade fever, some achiness, and that usually lasts for about 24 to 48 hours, and then you're just back to normal.
And of course, doctor, the most important thing is to continue that conversation with your primary care provider and your OBGYN.
Yes, and remember, you can do this because at age 11 to 12, pediatrics are welcome to do this vaccine, and we love it when they've already had their vaccines and come to see us as obstetrics and gynecologists. That is when I know we're doing the right thing.
And doctor, just to follow up here as well, can you mention some of the aspects when it comes to testing, at what age, when people should start getting tested?
Do you mean for the pap smear?
Yes.
Okay, that's been changing. So I'll give you what is the recommendation right now, but it is in the works of changing. Usually we start at age 21. We do pap smears up until age 30. Then at age 30, we switch to a pap and an HPV testing. It's every 3 or 5 years. Right now, this is in the transition of changing. So my information will be outdated in less than a month, most likely, okay. But that's what it is right now.
All right, doctor, thanks so much for your time this morning. We appreciate it.
Yes, thank you.
Have a great week. Check as your forecast next. We'll be right back.